Welcome to Burn the Rulebook. This is the podcast where we break down midlife, menopause, mental health, and relationships, one truth at a time. I'm Rachel Boyle, a licensed couples and individual therapist, sex therapist, and certified menopause specialist. Today, I want to share something a little more personal, the story of why I chose to specialize in women's sexual health and what led me here. Like many of the women that I work with, I did not realize that I was in perimenopause when I started perimenopause in my late 30s. I did not realize what was happening with my body. I was like 37, 38, and I was still having predictable periods. I was still going to work every day, taking care of my son and my relationships. I was still pushing through, but I was feeling really exhausted. I was having some brain fog, and I had this growing sense that something was off. And as I look back now, I could see the signs. I was having some hot flashes, not major ones, but some minor ones. And with the hot flashes came anxiety, which those two go together, by the way. They can, hot flashes and anxiety, even if you've never had anxiety before. And then I would wake up every morning and my feet would ache or my joints would ache, which I now know that's the skeletal muscular syndrome of menopause. But at the time, I didn't know what was happening. And I was having a hard time sleeping. So I did what most people do. I started to go see doctors. I had labs run. I even saw specialists. And because of the muscle joint issues, they were testing me for MS and other serious illnesses. And everything came back normal. Not one doctor ever mentioned perimenopause. And I want to say I saw several specialists. It wasn't until one of my girlfriends, who was a few years older than me, gently suggested, hey, this might be perimenopause. And I was like, what's perimenopause? I didn't know what it was. I had never heard of it. No one told me about perimenopause. Like most women, I had heard of menopause, but not perimenopause. So it turns out she was right. And that one conversation changed everything. I dove into research. I started reading, listening, studying, and what I uncovered was staggering. I started listening to a podcast called You Are Not Broken by Dr. Kelly Casperson. And I then listened to podcasts by Dr. Heather Hirsch, Dr. Mary Claire Haver. I read Estrogen Matters by Dr. Evan Blooming, and I read books by Dr. Lisa Mosconi on the menopause brain, and I realized I had been completely uninformed about my own body. And not only was I uninformed, but the medical profession was uninformed. And here I am. I have a master's degree. I'm a therapist. I've been trained to help others, but no one had taught me about perimenopause and the reality of it and what the symptoms are going through it. Most people just hear about the hot flashes, but there's so much more. So that led me to ISHWISH, which is the International Society for the Study of Women's Sexual Health. And that training was full of mainly medical doctors and nurse practitioners. There was maybe 2 or 3 therapists in the room. I was one of them because I thought if I'm going through this, then other women are going through this. And what I learned there floored me. At that time, and this was just a few years ago, there were 0 ISHWISH trained providers in the entire state of Nevada. They talked about it from the front of the stage because I was like, hey, I'm trying to find providers in Nevada to help my clients. And they said, this is a women's sexual health desert, and offered to help me bring education to Las Vegas. So after that training, I started screening all of my clients for perimenopause. And I had women that were already in my practice, and then women who were finding me showing up in my therapy room with anxiety, depression, relationship issues, panic attacks, low self-worth, issues with libido and sex. And they did not know they were in perimenopause. And so many of them were actually in the midst of these hormonal changes, but no one had told them about perimenopause. Some of them were in actual menopause, past the perimenopause, and still struggling with these emotional issues. And that's when it clicked for me. This this wasn't just my story. This is the story of so many women out there. And it's systemic, unfortunately, in our medical system. There's a really great book out there by Dr. Elizabeth Coleman called It's All in Her Head. And she gives the history of why modern medicine is still deeply shaped by a legacy of misogyny, meaning that women's sexual health hasn't been taken as seriously as men's sexual health. And for centuries, women's symptoms have been dismissed or labeled as emotional or hysterical. Even today, there's a lack of funding and research and training in women's health, especially in areas like perimenopause, menopause, and sexual functioning. So, in this book, Dr. Coleman highlights how the medical system often fails to treat women's body as worthy of evidence-based care. And it's not that the medical professionals don't care about us as women, it's just that they haven't been properly trained. And they haven't been properly trained because of this history that we have with women's issues being minimized and women being told, just go do yoga, do some breathing exercises, get some rest. You're just stressed out whenever they show up in doctors' offices complaining of these issues. And it's just that the doctors haven't been trained properly. So here we are. This is the result of that, is that in the United States, there's a significant deficit in trained providers when it comes to perimenopause, menopause, and women's sexual health. So women are left to figure things out on their own, like me, Googling symptoms, joining Facebook groups, relying on friends to get the answers when they should be getting this information from their providers. So let's talk about something else, and that is how rarely menopause gets mentioned and how it affects relationships and sex. So this is one of the most common reasons couples in midlife come into my office, is because they're having issues with sex where maybe they didn't have these issues before. Desire can change, arousal feels different, sex can become painful or suddenly feel disconnected from the normal closeness that you have with your partner. And most couples don't know why this is happening. And sometimes they don't have the communication skills to talk about it and find out what's going on. So they just know something's wrong in their relationship. So they show up in couples therapy. And what I love about this work is helping couples connect, helping couples to have deeper communication and having more intimacy and getting curious instead of shutting down. And so often that connection, it's not gone, it's just changed. And with that change can come new and different and even sometimes more fun ways of doing things. And it's not necessarily their fault. It's that no one gave them the tools or the information to navigate the changes. And we're not taught that estrogen, progesterone, and testosterone, that they're not just sex hormones. They are everywhere in your body. They impact your brain, your mood, your energy, your joints, and they can affect libido as well. And so that's why I chose to specialize in this field, because I knew that if I had an issue finding someone to help me, and I have access to education, I have access to resources, and I didn't know what was happening to me, then millions of other women were likely being misinformed too, and they didn't know what was going on with them. And because I saw the immediate transformation that would happen when women were simply informed, when they were told what was going on with their bodies and why, and that they weren't just going crazy, that there wasn't something wrong with them, that the symptoms they were feeling were real and explainable. And it was because that their hormones were changing and that can also be treated. Then women started, in my practice, they would have sighs of relief. They were so happy, and not because everything was solved, but just because they were finally able to connect the dots. So that's what this podcast is about. This podcast is about giving you the information, the tools, and the language to understand your own body. And when you understand your own body, then you can advocate for yourself. You can build even healthier relationships based on healthy communication. And you can start sharing this information with other people that you know, and it will help them as well. So if you're wondering what's going on with your mood or your sleep or your body, your libido or relationships, or if you felt dismissed by the medical field, or if you're just starting to feel off and you can't explain why, then this podcast is for you because you're not going crazy. It's just that your body is changing and you deserve real support.